Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks about psychopathy and sexual behavior. So what's the relationship between psychopathy and sexual behavior? And I've also seen a few questions on the relationship between psychopathy and sexual fantasies. So I'll try to answer both of those questions. So I used a number of articles here for this video, and I'll put the references for those articles in the description for this video. So let's first start with the construct of psychopathy. So psychopathy is an interesting construct. It's not a mental disorder. It has a relationship to antisocial personality disorder, which is a cluster B personality disorder in the Diagnostic and Statistical Manual. But psychopathy is really a set of personality traits. It's, again, a construct, and it's measured on a continuum. So there really isn't an agreed upon definition of what score somebody would have on some sort of measure of psychopathy for them to be referred to as or considered to be a psychopath. We really don't have that type of clarity. Certainly if we see extreme behaviors and somebody appears to have all the traits, it would be more likely that we would think of that person as psychopathic. But either way, it's important to remember that it has a subclinical component. So somebody could have psychopathic traits and not qualify for a diagnosis of antisocial personality disorder, but also there appears to be a clinical element at the higher expression, the more extreme expression of psychopathy. So there we may see a stronger relationship with antisocial personality disorder. Now, psychopathy also has two different types. So we see factor 1 and factor 2 psychopathy, sometimes called primary and secondary. So with factor 1, we see a superficial charm. So this is when somebody is charming, but there doesn't appear to be a lot of depth there, a lot of emotion. We see grandiosity, similar to what we see with narcissism. We see somebody who's callous, unemotional. We see pathological lying, manipulation, and also a lack of remorse or a lack of guilt. With factor 2 psychopathy, we see some of the traits that more closely align with antisocial personality disorder, like impulsivity, irresponsibility, and engaging in criminal behavior. So psychopathy isn't really a simple construct. There's a lot to it, and its relationship, again, with mental disorders is not one-to-one. It's not perfectly correlated with mental disorders like, again, antisocial personality disorder, or for that matter, a disorder like narcissistic personality disorder. Now, we talk about psychopathy and sexual behavior or sexual fantasies. I'm going to start here by discussing the callous, unemotional traits that sometimes we see in adolescence. So if we look at psychopathy as a construct, somebody can have psychopathic traits at any age. Somebody can only have antisocial personality disorder if they're age 18 or older. When somebody's under 18 and they exhibit a lot of those characteristics, sometimes they get diagnosed with conduct disorder. And there's one particular specifier with conduct disorder we see is closely related to psychopathy. And this is limited prosocial emotions. And this is the same thing as the callous, unemotional traits. So low levels of guilt, lack of empathy, being callous, and being uncaring. So we just put those characteristics under that specifier, limited prosocial emotions. Now we see here that there's studies that show that male adolescents who have elevated callous, unemotional traits are more likely to engage in frequent, violent, and planned sexual offenses. So these traits really have some negative consequences associated with them in the area of sexual behavior. We also see that the callous, unemotional traits in adolescents are associated with an increased number of sexual partners, unprotected sex, causing or experiencing pregnancy, and contracting a sexually transmitted infection. So again, just a lot of negative consequences with conduct disorder and that limited prosocial emotions specifier. So if we move over to the idea of sexual fantasy, here we don't see a lot of studies with the callous unemotional traits, but we do see a few studies with psychopathy in adults. And what we know about sexual fantasy is it's actually very common. The vast majority of individuals in the general population have sexual fantasies. And there are some differences with sexual fantasies based on sex. We know that men tend to have more fantasies about multiple partners within a single sexual encounter as compared to women. And we know that women tend to have more fantasies about submission, committed partners, and romantic settings as compared to men. So again, there are some sex differences there to keep in mind with sexual fantasies in general. Now, in talking about psychopathy and sexual fantasies and sexual behavior, we know that varied and uncommitted sexual behavior seems to be really connected to psychopathy. We know that psychopathy has a relationship with more sexual aggression, sexual coercion, sexual deception, and deviant sexual behavior. And when we use the term deviant sexual behavior in research, we're really talking about the paraphilias, like sadism, voyeurism, exhibitionism, those different paraphilias. And specifically with sadism, we see research that shows there's an incredibly strong relationship between sadism and psychopathy. Now, we know that psychopathy is positively associated to a preference for non-romantic sexual fantasies, and also sexual fantasies that involve anonymous and uncommitted partners. We see here that participants who reported high levels of fantasizing about these sexual themes were more likely to engage in that behavior if they also reported high levels of psychopathic traits. So here we see a connection between psychopathy and acting out a sexual fantasy. So it's really more than just we see these increased sexual fantasies with people who are psychopathic. There seems to be a relationship where there's a follow-through. So if somebody has high levels of psychopathy, high levels of psychopathic traits, they're more likely to engage in real-life sexual behavior that's consistent with those fantasies. So at first, looking at this finding, some may theorize, well, the psychopathic traits must lead to an increased level of fantasizing, and that fantasizing leads to the acting out in the sexual behavior. So it leads to the actual sexual behavior that lines up with the fantasy. But there are a few different theories that could be at work here. What if an individual has high levels of psychopathic traits, and then they happen to engage in a particular sexual behavior, and because of those psychopathic traits, they're more likely to fantasize about that activity? So all the components would still be there. Somebody would have psychopathic traits, they would be engaging in sexual behavior, and there would be a lot of fantasies. So we can't really make any clear determinations here about what behavior or what characteristic causes another. We don't know for sure that psychopathic traits lead to more fantasies, and that leads to more behavior. It could be that the behavior and the traits occur at the same time, and then the fantasies are just more likely to occur because of those psychopathic traits. Again, these constructs are complex, and the relationship to one another is complex. And we really need more studies to try to figure out what comes first, what may lead to another behavior or another characteristic. Now, another area we hear about with psychopathy quite a bit is pornography. And there's different theories with pornography, like individuals who have psychopathic traits are more likely to use pornography, and this leads to different problems. And what we see from this study is psychopathy is related to greater pornography use, but that relationship didn't add to the prediction of real-life sexual behavior. So using or not using pornography didn't have any connection to how often somebody who's psychopathic acted out sexual fantasies or engaged in sexual behavior somewhat consistent with those fantasies. So the role of pornography really isn't clear when it comes to psychopathy. Another theory we hear about psychopathy sometimes is that if a male has psychopathic traits, they're more likely to engage in fantasized sexual behaviors as compared to a female. This study found that that really wasn't the case. They found that the participants' sex did not moderate the relationship between psychopathy and engaging in fantasized sexual behaviors. Moderate there means it didn't change the strength or direction. So if we look at the findings from this study, we see that the sexual behavior of individuals who have psychopathic traits is probably due to a preference for sexual activity that's outside of a committed, loving relationship, as opposed to an inability to form those types of relationships. So we're not really talking about compensating for a deficit here. A lot of times I think that's what people believe about psychopathy. Individuals with psychopathy engage in these different sexual behaviors that have these fantasies because they can't have a romantic, loving, committed type relationship. They can't have a more normative sexual relationship. That's how we usually think of sexual relationships. They involve some sort of degree of commitment, love, and affection. But the reality is that's not what's going on. This isn't again, about compensation. This is about a preference for a particular type of sexual activity that's more cold and distant. And I think this is an important element in terms of treatment. I've seen over the years of my clinical experience many instances where somebody appears to be in a relationship with somebody who has psychopathic traits. Now remember, from the position of a counselor, we really don't know that unless we were to assess that other person in the relationship, which of course isn't something that would happen. We don't really know if somebody has psychopathy or not. But still, there appear to be traits based on what a client says. And the client believes that if they engage in the sexual fantasies that the psychopath wants, then somehow they'll uncover a caring, loving demeanor underneath of that. Somehow they'll get to the core of that person and they'll find that they're really caring and loving this whole time along. That they just needed those sexual fantasies to get to that romantic point. And that may be true some of the time. Again, we don't really know what the characteristics are of that other person. But a lot of times what I found is there's not a loving core underneath of those sexual fantasies. So people come into counseling and they'll give in to their partner, sometimes for years, and nothing really changes. Sometimes actually giving in to the sexual fantasies and allowing them can make things worse. So again, this is really just stressing the importance of seeking counseling and being open to different ideas in terms of insight and looking at characteristics realistically, rather than just giving in automatically and just hoping things will work out. Sometimes there's not another level. A lot of times with human behavior and cognition, we want to believe the best with people. We want to believe that the level we're looking at now is one tier, but there's some other level of complexity or lovingness that's unseen. And sometimes, particularly with psychopathy and some other types of traits, sometimes that's just not there. And I think that's really where this finding connects with clinical practice probably more closely than some of the other findings in this study, although they're all fairly interesting findings. Now, it's also important to note here that not all the sexual fantasies are necessarily abusive. Sometimes people engage in these fantasies and both people are satisfied with that. What I'm really talking about here with psychopathy and somebody holding out hope is the abusive type fantasies. They participate in sexual behaviors that they don't really want to participate in, again, in hopes that they'll find something else in that person. So that's what I'm really talking about here, not consenting adults that both want to engage in some sort of sexual fantasy that's played out, and they agree to it, and it's what they want to do, and they have good communication about it. I'm not really talking about that with this example. Another element that's important to separate out here is the idea between narcissism and Machiavellianism and psychopathy. These three traits put together are called the dark triad, and the research shows us that the dark triad is associated with deviant sexual fantasies. But psychopathy has a much stronger relationship to deviant sexual fantasies as compared to narcissism or Machiavellianism. So you can't really treat all three of those the same in terms of their impact or in terms of thinking about what potential impact they may have. So that's kind of my summary here of psychopathy and sexual behavior and sexual fantasies. If you have any opinions or thoughts on this, please put those in the comments. As always, I hope you found this description of psychopathy and sexual behavior to be interesting. Thanks for watching.